When I arrived in Canada as a Black African migrant, I carried more than travel bags. I carried questions about belonging, safety, and what it means to navigate a new healthcare system. Hi, my name is Daniela Fombang, and my work focuses on strengthening the health and well-being of Black communities affected by HIV in Canada. My research journey began years ago in Cameroon during my master's and has now continued through community-engaged HIV research here in Canada. That has shaped the direction of my PhD. Across these stages, one theme has guided me: empowering communities with knowledge that honors their lived realities and challenges the systems that fail them. Let's flash back to my research in Cameroon, where I investigated HIV testing, treatment uptake, and viral suppression in an urban district heavily affected by conflict and health system interruptions. Testing and viral suppression targets were not met. As I interviewed clients and reviewed medical records, I saw something very clear. People were not disengaging from care because they were non-compliant. Rather, they were facing poverty, stigma, fear, structural barriers, and relationships shaped by unequal power. That taught me that health behavior is never simply individual choice. It is deeply social, cultural, and structural. And when we fail to understand context, we fail people. That insight became the foundation for the work that I do today.
The moment I got here for grad studies, I joined a research team working with Black communities to understand post-arrival HIV acquisition patterns. What we found challenged common assumptions. Many of these migrants who acquired HIV after arrival in Canada were navigating complex emotional, relational, and socioeconomic realities.
From this study conducted with Black migrants in Canada, men often reported being unaware of their sexual partner's HIV status. Women described being unable to negotiate condom use due to relationship power dynamics. And across genders, some partners concealed their HIV status entirely. These insights challenge the conventional biomedical narrative that HIV acquisition is simply about risky behavior. Instead, we highlighted how migration stress, gender norms, stigma, loneliness, and structural marginalization shape people's vulnerability. Sharing these findings with community organizations showed me the power of research that speaks honestly about people's lived realities without blaming them.
Now in my PhD, I am returning to these Black communities, this time not for HIV acquisition patterns, but to know their lived experiences, their experiences with navigating healthcare in Canada. And here is the thing: how can care be acceptable or beneficial to its beneficiaries if it's not tailored to their specific needs? Hence, this study seeks to inform culturally tailored interventions for Black people living with HIV in Canada. But we must start with asking questions that only the target audience can answer.
The question then is, how do they experience care? Specifically, what barriers and facilitators shape their treatment journey? How do inequalities intersect to shape decision-making? And what meanings do they attribute to their healthcare encounters? By employing phenomenology and intersectionality, I am not only documenting experiences, I am centering voices, helping uncover why these experiences occur and how systems of care can be transformed. This work empowers Black migrants in three key ways. It transforms them from subjects into knowledge holders. It provides knowledge that helps them participate confidently in healthcare, and it challenges old assumptions and forces a shift in thinking. Ultimately, this work shifts the focus away from blaming communities and toward understanding the systemic inequalities that influence health outcome. This encourages both communities and health providers to think critically about cultural safety and systemic bias. I am committed to producing research that not only generates knowledge, but also restores dignity, voice, and agency to the communities I serve.